Hello, my name is Sofia de Oliveira, and I am an assistant professor at Albert Einstein College of Medicine. Today, I will talk about how we are using the zebrafish animal model to study the impact of the consumption of Western type diets and overnutrition in neutrophil biology. Systemic chronic inflammation is a major economical burden for modern societies. It is found in multiple disease scenarios and can be driven by multiple factors. In my laboratory, we are particularly interested in systemic chronic inflammation in the context of metabolic syndrome and non-alcoholic fatty liver disease and cancer that is triggered by the consumption of Western type diets and overnutrition. The consumption of such diets, which are rich in fat, cholesterol, and/or sugar, promote a metabolic imbalance and cause inflammation, which is often referred as metainflammation. Patients with metabolic syndrome are at high risk to develop serious health complications with a poor clinical outcome due to a hyperreactive and dysfunctional immune response. Importantly, neutrophils are key cellular um, play and major contributors to the progression and to the development of such conditions. In my laboratory, we are currently working on trying to understand how does diet-induced metabolic dysfunction impact neutrophil biology, and how such effect alters disease progression and outcome, and how can we revert the unfavorable scenarios found in these conditions. To answer these questions, we are taking advantage of the amazing transparency of the zebrafish model to perform non-invasive live imaging of the inflammatory response in an all-animal context. This unique approach is helping us to take into consideration the complex and intricate interplay that occurs between tissues and organs in metainflammation. We and others have shown that a high cholesterol diet induces metabolic syndrome and non-alcoholic fatty liver disease in zebrafish. Interestingly, we found that cholesterol surplus triggers a systemic low grade of chronic inflammation that is characterized by the infiltration of neutrophils and macrophages to different tissues and organs. But what is the impact of a cholesterol surplus on neutrophil response towards, for example, a sterile tissue injury? Using the tail fin amputation model, followed by non-invasive diagnostic confocal microscopy, we observed that cholesterol surplus leads to a hyperreactive neutrophil response and swarming behavior towards a sterile injury in larvae that were exposed to the high cholesterol diet. This was characterized by this increased recruitment of neutrophils to the sterile injury site, but also we also observed a delayed resolution, as you can see here, by the accumulation of neutrophils at 24 hours in larvae exposed to a high cholesterol diet compared to the normal diet. In addition, we also found that cholesterol surplus induces or increases RAS production at site of injury in larvae exposed to the high cholesterol diet. Overall, our data suggests that cholesterol surplus alters neutrophil biology and induces a dysfunctional response. Our data show that cholesterol surplus induces metainflammation in zebrafish and is associated with a hyperreactive and dysfunctional neutrophil response. In addition, I didn't have time today, but we also found that neutrophils from inflamed areas can undergo reverse migration after secondary inflammatory stimuli. And we also found that different pharmacological treatments can partially rescue systemic chronic inflammation and reduce the effect of high cholesterol diet on neutrophil response. Thank you for watching.